Adeed, with a vision to become the leading provider of home healthcare, following the standards of Joint Commission International to provide equality of service, complying the international patient safety goal, identify patient correctly, improve effective communication, improve the safety of high alert indication, and reduce the risk of healthcare-associated infection. Reduce the risk of patient harm resulting from falls. These goals are applied to provide a safe and excellence of service where Adeed treat their patient as their family. Before going to the patient's house, ensure that you have prepared everything. Checking the patient's referral form uploaded by the customer experience at Home Healthcare Information System. Do research for the case of the patient based on the referral form or endorsement by your colleagues that recently handled the patient. Check your Outlook email for the location of the visit sent by your supervisor. Put all the things needed for the visit in your red bag. Base the items on the approved checklist or what kind of service needed by the patient. Ensure the equipment is available, functioning, clean, and has updated periodic preventive maintenance. Bring the necessary documents needed in the visit like general contract, patient's right, vital signs and blood pressure monitoring sheet, random blood sugar monitoring sheet, photo consent, confirmation visit, and medication list. Ensure to follow the dress code to look professional. Hair is well kept and tied, ironed Adeed uniform, white socks and shoes. When everything is all set, get up, dress up, show up, never give up, because you're ready to go.
Assalamualaikum, kefalik?
Waalaikumsalam. Alhamdulillah, you are the nurse from Adeed.
Yes, I am the nurse from Adeed here for reassessment visit.
I see the daughter of Madam is not here, so your colleagues will assist you, but she'll be here in 30 minutes for Madam medicine.
Not a problem, but first, may I wash my hands?
Sure, I'll show you where you can wash your hands.
Thank you.
Prior washing your hand, lay your bread bag first for proper posture before doing hand hygiene. Select an area you want to put your red bag. Place an underpad, then followed by your red bag. IPSG number 5. Reduce the risk of healthcare-associated infection. How to apply? Through hand hygiene. There are 2 types of hand hygiene. Hand washing using soap and water, 40 to 60 seconds, and hand rub using hand sanitizer, 20 to 30 seconds. When to apply? Remember the 5 moments of hand hygiene. Number 1, before touching the patient. Number 2, before doing a septic or clean procedure. Number 3, after exposure of bodily fluids. Number 4, after touching the patient. Number 5, after touching the patient's surroundings. These are the position of the hands during hand washing and hand rub. First, apply enough soap or hand sanitizer, then rub hands palm to palm. Next, right palm over left torso with interlaced fingers and vice versa. Then followed by palm to palm with fingers interlaced. Next, backs of fingers to opposing palms with fingers interlocked. Followed by rotational rubbing a left thumb clasped in a right palm and vice versa. Lastly, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. When doing hand washing, ensure to rinse thoroughly the soap suds in both hands. Dry your hands thoroughly with a tissue and use the tissue to turn off the faucet. Now you're ready to interact the patient.
Salam, Jen.
I am Jen, Adeed registered nurse. Happy to serve you for an hour visit. Since this is our first meeting, may I have your first, middle, and last name? And how do you want me to call you, by the way?
I am Darren Sipula. You can call me Mama as everybody's address.
Ay, Mama. Mama, can I have have your Saudi identification card for verification purposes?
Good thing your colleague remind me of it. Here it is. Looks my younger days.
Thank you,
Ay,
Mama.
mashallah.
Mashallah, Mama.
Jamila, sa?
Yeah, very Jamila, Mama. You look younger. By the way, Mama, you look wonderful inside, even outside today.
Oh, you're so
Alhamdulillah.
sweet.
If patient is unconscious, pediatric, and mental and psychological problem, identify through caregiver, family members, and legal guardian. During the second encounter with the patient, still ask for the first, middle, and last name and verify with the facial recognition. If patient does not have 3 names, verify with the following: date of birth, order number which must be provided as a screenshot from Tawakkalna or Bashir.
Mama, before we start, I need you to read and affix your signature on these documents consisting of general contract, consent, and also visit confirmation while I am preparing for the materials needed for the reassessment and also admitted with your nursing assistant, Mama, okay?
Sure, hand me these documents. Oh, where's my eyeglasses?
Sa'yo mga pili na.
Shukran.
Hapon.
Oh, I forget. It's a signs of age.
Yeah.
My mistake.
Mal. Musti lang.
IPSG number 2. Improve effective communication. How to apply? Through structured communication technique, SBAR. S stands for situation. It briefly states the main current complaint of the patient. B stands for background. It is the patient's medical history, social background, allergies, any operation experience, and medication. A for assessment. This is the current vital signs of the patient, input and output, and latest lab report and X-ray result. R. Recommendation. These are the goals, the treatment, nursing intervention, and discharge needs of the patient.
So how are you with the patient?
My patient, Darren Singh Dulay, 56 years old, is currently experiencing bipolar non-pitting edema. Patient was diagnosed 2 years ago, type 2 diabetes, hypertension, and hypothyroidism. And medication were given by the doctor.
Okay.
Okay, ma'am, these are the medication list. Bisoprolol, 0.25 milligram tablet or half of the tablet per oral once a day, the night. Number insulin, Aspar, Novo Rapid, or Flex Pen, 20 units. Then, the doctor received the lab results today and she is willing to share it with us.
That's great.
Okay. Vital signs taking at 10 a.m. The results are the following. Body temperature 36.5 degrees Celsius via temporal. Respiration 18 breaths per minute. Pulse rate 87 beats per minute. Blood pressure 120/80. And I've noticed, Ma'am Jen, Mama has bipedal non-pitting edema. I think I suggest that if you can look for Mama, make sure and check for the lab result.
Okay, not a problem. Yes, Mama?
Here's your paper.
Mama, thank you for signing these documents. Now, I am going to proceed with the head-to-toe assessment. My colleague will help me all throughout the procedure, okay?
Another way to reduce the risk of healthcare-associated infection is through equipment care. After doing your head-to-toe assessment, vital signs taking, or after using your medical equipment, always do hand hygiene, then don gloves to proceed with the equipment care. Always follow the 60 seconds wet time. Wipe your equipment using the approved disinfectant wipes. Wait for the equipment to dry. Place it in an underpad. Then once dry, Put it in the red bag. Dispose things used in proper waste bag. Used PPE, used gauze, food waste, packaging materials, underpads should be disposed to regular waste bag. While drenching in heavily soaked gauze, underpad, and dressings with bodily fluids, items like PPE exposed to patients with transmittable disease will be disposed to the yellow waste bag. It is also important to know how to wear and remove personal protective equipment or PPE. For donning or way to wear PPE, first thing is hand hygiene, then followed by gown, face mask, face shield or goggles, then gloves. For doffing or proper way to remove PPE, first thing is gloves, then followed by face shield or goggles, gown, face mask, and hand hygiene.
So, Mama, do you have history of falling in the last 3 months?
Not so far.
IPSG number 6. Reduce the risk of patient harm resulting from fall. Who are at risk for fall? 6 years old and above, infant and pediatric, 3 or more coexisting disease or diagnosis, polypharmacy, impaired functional mobility, visual impairment, history of fall 3 months ago. When to assess? During initial assessment, reassessment, skilled visit, patient is placed in a new environment after 30 minutes to an hour taking a medication that may increase the risk for fall.
That's good to hear. We will prevent that from happening, okay? Mama, I can see that you have a wheelchair. Ensure at all times before transferring to keep the wheels brake locked at all times, okay? And also, by the way, Mama, make sure to keep clutters free, keep the floor dry, and also provide adequate lighting, use night lamps. Also ensure that your personal belongings are within your safe reach, just like your glasses, to put the care table next to your bed, okay? And with dizziness, you still need first to sit, and then wait a minute before getting up, okay?
Excuse me, Mama, this is the juice that you ordered.
Yeah, Abby! Please clean it right away before anyone's get accident.
Sorry, Mama. I will be
Sura,
right
sura.
back with Mom.
Yala sister sa widari, ha?
Mama, I will just get another juice for you, huh?
It is important to know things to do when the patient experiences fall. For an witness fall, the nursing assistant will do the following. First, check patient status like vital signs or any abnormalities. Then, perform fall risk assessment. Then, report to the primary RN or supervisor. And don't forget to submit incident report. For registered nurse, these are the things to do. Reassess the patient, perform fall risk assessment, educate the patient and try to find the reason of fall, report to supervisor and submit incident report, modify care plan as needed, then re-educate the family, patient, and caregiver, communicate patient fall and revise care plan with multidisciplinary team, and discuss care plan in multidisciplinary meeting. These are the intervention in witness fall. For nursing assistant, it is important not to move the patient right away. Then, assess the patient's vital signs, pain, or if any abnormalities. Report right away to the primary registered nurse or supervisor, then follow the orders from primary RN and supervisor, and do not forget to submit incident report. For registered nurse, still do not move the patient, assess the vital signs, pain, and abnormalities, report right away to supervisor and attending physician, follow orders from attending physician, repeat fall risk assessment, reassess the patient, modify care plan as needed. Don't forget to re-educate the patient, family members, and caregiver, communicate patient fall, complete incident report, and revise care plan with the multidisciplinary team, discuss the case in the multidisciplinary meeting.
I'm sorry, I'm late. Are you the RN who was mentioned by the call center to check my mom?
Yes, ma'am. I am Jen. I am the registered nurse assigned to your ma'am. Actually, I am done with the head-to-toe assessment, and they mentioned that you left to buy medication.
Yes, I have the insulin and warfarin medication that was prescribed.
Oh, okay.
Yes, here.
Can I see? Oh, since you mentioned about medications, actually, ma'am, this is the medication list that Mike really mentioned. Can you verify if this is correct? Aside from the medication that you just bought,
Yes.
which our company considers as high alert medications?
Okay.
IPSG number 3. Improve the safety of high alert medications. High alert medications of Adeed is based in ISMP. These are the anticoagulant, insulin subcutaneous, immunosuppressant agent. Ensure to indicate high alert medication in the medication list. Always follow the approved abbreviation. International units should be spelled, not abbreviated, same as the word daily. Put a leading zero to decimal point and prevent trailing zero when it's a whole number. Re-education needs to be done when there's a change in medication, change in patient condition, change in the person responsible for the medication administration. Always check the proper disposal and storage of medication as per manufacturer guideline.
Okay, they are correct.
Okay, and also, since you have medications that is injected subcutaneously, it is important to properly dispose of the syringes. You can actually buy short boxes with a label on it, and also you can have an alternative way. You can use actually the empty or hard empty bottles of a fabric conditioner.
Okay, I got it. Thank you.
Sorry to interrupt. You mentioned that you will share the lab result today with my colleague.
Oh, alright. Thank you for reminding me.
Thank you. Let me see. Let me just go ahead and double check. Okay.
Disclaimer: the lab results in these videos is only an example, and its purpose was to emphasize ways to improve effective communication when conveying message about critical values. These are the critical values considered in Adeed. It is sorted out according to age group. There's a value for the adult, newborn, the children, and the elderly. You can always check the critical values on the uploaded policies in your respective tablet under Patient Access and Assessment folder.
Oh, I can see here that there is an increase specifically with the hemoglobin A1C and also the fasting blood sugar. Let me just go ahead and report this to our physician to make an appropriate management, okay?
Okay.
Hello, doctor. I have a patient named Daring Singgulay, 56-year-old female. MRI number 123, experiencing bipedal non-pitting edema, an increase of hemoglobin A1C 8.40, fasting blood sugar 9.47. The result, doctor, was taken today at 9 a.m. The patient was also known to have type 2 diabetes, hypertensive, and hypothyroidism. And the medication is listed, it's the same on the medication that she have on our system. The vital signs are within the normal parameters. No pain felt today, bipedal non-pitting edema. Is there any management for the patient based on the significant lab results, doctor?
So to confirm, the lab result was for HbA1c is 8.40 and fasting blood sugar is 9.47.
Another way to improve effective communication is by proper way of receiving telephone orders and critical values. Remember the 3 steps: writing down the verbal telephone order or test result by the one who's receiving, then reading back the verbal or telephone order or test result by the one who's still receiving, and confirming the verbal or telephone order or test result by the one who is releasing it.
Yes, doctor, you're right with the lab result.
Make sure to have a copy of the lab results and upload it in our home health care information system for access. I also opened her file and I can see that there is an increase of lab results, more specifically of her HbA1c and the fasting blood sugar, comparing from the previous lab results. Continue to educate the caregiver about the plan of care of the patient. All the medication is the same except for an increase of 3 units of dosage for the short-acting insulin. Moving forward, starting tomorrow, the patient will take insulin aspart, Novorapid Flex Pen, 22 units, injected subcutaneously thrice a day, every 6 a.m., 12 p.m., and 6 p.m.
To confirm, doctor, the new prescription of insulin will be insulin aspart, Novorapid, FlexPen 44 units, injected subcutaneously twice a day, every 6 a.m. and 6 p.m. Is that correct?
No, I will repeat the new prescription. It's insulin aspart, Novorapid FlexPen, 22 units of insulin, injected subcutaneously 3 times a day, every 6 a.m., 12 p.m., and 6 p.m.
Oh, I apologize, doctor. I will just read again and confirm. The new prescription of insulin will be insulin aspart, Novorapid FlexPen. That will be 22 units, injected subcutaneously. That's 3 times a day, every 6 a.m., 12 p.m., and 6 p.m. Is that correct?
Correct? Please make sure that I have a copy of the medication list so I can review and affix my signature before giving the medication list to the patient and family members. Don't forget to Thank you, doctor.
Another way to improve safety of high alert medications is that staff review the order and be familiar with the medication, including its indication and potential side effects. Staff verifies the rights of administration, right person, right medication, right dose, right frequency, and right duration. As Adeed does not supply or store medications, staff focuses on educating the patient and or responsible representative. Patient or family member and legal guardian must be actively involved in decisions related to medication storage and labeling to assure understanding and avoid medication errors.
Ma'am, doctor mentioned that there will be a prescription of short-acting insulin for Mama, and that will be starting tomorrow. It will be insulin aspart, Novorapid, FlexPen, that will be 22 units to be injected subcutaneously 3 times a day, every 6 a.m., 12 p.m., and 6 p.m. You will be the one responsible for giving the medications, while our nursing assistant will be there to remind you of the timing and the dosage of the medications, okay?
Okay. Is there any new management for my mother?
Yes, since you asked, ma'am, thank you for your hospitality and your time. The updated medication list and also the plan of care will be given by our customer service through your email, okay?
Okay, that's great.
All clinical staff should complete documentation within 24 hours. Upload the necessary documents presented during the visit, like lab results, medication list, medical history, photo consent if necessary, and the pictures taken. Summary: International Patient Safety Goal is the foundation to provide a safe, quality service to the patient.